Read the stamp, brother.
Okay, 65 years old patient with type 2 diabetes on oral medications, presented with perianal abscess, therefore went for incision and drainage.
What are the types of diabetes mellitus and describe the pathogenesis of each?
Okay, there are basically two types of diabetes mellitus, one type 1 and type 2. In type 1, there is a destruction of pancreatic beta cells, autoimmune destruction, which leads to complete insulin deficiency. Whereas in type 2, there is insulin resistance, and um, yes, sir,
Okay, the insulin resistance
and low
and
insulin level in type
low
2.
insulin level, relative deficiency of the insulin secretion by the pancreatic beta cell. What is the function of insulin? What are the hormones affecting by the blood glucose level?
Not audible.
Can you hear me, Dr. Pravat? Dr. Pravat, can you hear me?
So you are not audible.
Okay, now what is the
Yes,
function of
I can hear
insulin
you.
and what are the hormones affecting by blood
Okay,
glucose level?
okay. So um, the insulin in carbohydrate metabolism, it increases uptake of the glucose with so it decreases the blood glucose level,
Okay, what else?
helps in protein synthesis,
Okay,
and in fat it uptakes lipid, it prevents basically lipolysis, and it is antagonist to glucagon hormone.
okay, what are the other hormones affecting the blood glucose level?
Okay, so glucagon and uh, corticosteroids,
And catecholamines like epinephrine,
catecholamine.
norepinephrine, correct? These are the stress hormones.
Yes.
Now, how to prevent the intraoperative hypoglycemia and what are the precautions for the diabetic patients going for surgery?
Okay, so while preparing the OT list, the patient with diabetes should be prioritized early, and also we need to check WHO safety surgical checklist for the patient drug is patient medication, and we should not advise the patient to skip more than one meal, and if there is uh, any requirement to increase the meal skip meal, then I would like to add the patient with insulin infusion intraoperatively, and also capillary blood glucose monitoring hourly, and so the target blood glucose should be 6 to 10, and the fluid that should be administered is 0.45% sodium chloride, and with 5% dextrose, and yes, sir.
And 0.3% of potassium chloride. Okay, this is the recommendation.
Potassium.
Very good. Now, post-operatively, you should use the analgesics, antiemetics should be used to enable the early return to the diet and okay, and usually insulin regime. Now, if the patient is
Yes.
having hyperglycemia post-operatively, what you will do, I can use the sliding scale, okay,
Yes,
now,
sir.
or the variable rate of insulin infusion. So, and you can involve the endocrinologist as well. Now, the immediate and less post-operative complication of hyperglycemia.
So immediate complications of diabetes will be hypo or hyperglycemia, and there might be dehydration, and also electrolyte imbalances, fluid and electrolyte imbalances, and late will be diabetic ketoacidosis in some case, ketone bodies, and also hyperglycemic hyperosmolar syndrome, hyperglycemic hyperosmolar syndrome.
So these are the immediate complication, correct? The hyperglycemia, hypoglycemia, dehydration, electrolyte imbalance, the hyperglycemic hyperosmolar syndrome, the DKA. These are the immediate complication. Now the late complications are, the infection, sepsis,
Delayed
and wound
healing.
healing. Yeah,
Okay, delayed healing.
yeah, delayed. Now, post-operatively, who will you involve for the care of this patient?
Yes, sir. I would involve the patient. I would involve the endocrinologist and also anesthesiologist.
So, if post-operatively the patient blood glucose level is not well controlled on oral medication, what you will do?
Yes, sir. I will convert the oral medication to insulin therapy. So the patient need to administer subcutaneous insulin.
Very, very good, superb. Okay.